Hi, everyone. Thank you so much for joining our final session of the conference, Volunteering Aboard the Africa Mercy. My name is Jacinta, and I'll be hosting the session. I'm excited to introduce Ruth Wong, who is joining us all the way from the UK. Graduating from the hospital in Oxford, Nurse Wong went on to specialize in orthopedics and work in the orthopedic aftercare department. Since semi-retirement, she has been using her skills to help those in countries where healthcare is limited. Today, she will be sharing more about her work on a floating hospital ship called the Africa Mercy and giving hope and healing to so many people in West Africa. Please welcome Nurse Wong.
Hello. I take it you can hear me, Jacinta. Is everything running fine? Okay, I'm going to thank you for inviting me. It's 11 o'clock at night here, so I hope I can keep you all entertained and enthusiastic about the work that we do in West Africa. So I'm going to share my screen. There will be lots of opportunities for asking questions at the end, if that's okay. So you should be able to see a picture of the Africa Mercy. Jacinta, can you put your thumb up if that's correct? Okay, that's fantastic. So this is our flagship at the moment, and it's a Christian organization, actually based in America, and it's we follow the 2,000-year-old model of Jesus, bringing hope and healing to the poor. Now, it was actually started by a couple of Americans who had a child who was severely disabled. And he realized that the care that he had in the States was really fantastic. And it came to his conclusion was that actually there were so many places all over the world that didn't have this care. So he was working with an organization called YWAM, which is Youth with a Mission. And he had this vision of seeing a white hospital ship actually being able to go to those places. And this was the first ship they had, the Anastasis, the first hospital ship. The other two were just little coastal ones that took crew to do dental work or eye work in local villages that they had access to a port. But soon the Anastasis wasn't suitable or big enough, and it was becoming quite old. So with a lot of help from donations, they bought this ship called the Dronning Ingrid from Sweden and Denmark, and it was a roll-on, roll-off railway ferry. So you can imagine this is not really suitable for a hospital ship. So they brought it over to the UK, and after many years of planning and work done on this, it was converted into what it is now, a fantastic white hospital ship. Now, this is after it's been in Gran Canaria undergoing some renovation work. Every year it has to go to Gran Canaria for either dry dock or ordinary dock. And then it goes off to a country for 10 months. And I know that because you can see on the top of the ship, on the top deck, lots of vehicles that they use to get people out to the local clinics. Now, people say to me, oh, you're going on your cruise again. Well, if you compare the Africa Mercy on the left to a cruise liner on the right, and that's not a big one, you can see the comparison in size. But the Africa Mercy is by far the more important ship there. So we go into a country, they invite us to go, and they give us dock space. And in Benin, we had a fairly big dock space, which allowed us to park the vehicles on site in the port and also have some activity areas. You can see there's some tents on the dock, which is the outpatients, the physiotherapy, the admissions, and the waiting area. And That's at the pointy end of the ship, and at the stern, it's where the maintenance is done and they load containers onto the ship and fill up with fuel. And as I say, it stays in the port for 10 months. And why do we go? We go because 2 out of 3 people lack access to surgical care. And that isn't just any old surgical care. It's the safe, affordable and timely surgery. These statistics were put up before we were hit with COVID, but it is just under 33% die from a year lack of access to safe, affordable and timely surgery, which is more than quite a few other causes as well. That equates to between 16 and 17 million people every year. And we go to West Africa. 93% of sub-Saharan Africa can't access this healthcare that they need. So we reach the people who have little or no healthcare in the poorest parts of the world. This is the area that we go to. Now, remember, I said it was a ferry, and so it's got a bit of a flat bottom, so it doesn't travel very well. It did go to Madagascar for the years when Ebola hit Guinea, but we tend to keep the work into the west coast of Africa. Now, I've been really fortunate to be able to serve in Benin, and Cameroon, which is just on the armpit of Africa. And I've also done Guinea and Senegal. When I went out to Africa, I hadn't got a clue what it was really like. And flying in over Mauritania, this is what you see. This is the Sahara Desert, and for 40 minutes, beautiful views out of the aircraft, but that is the view you see. So of course, when you land in Senegal, this is the part of Senegal which is very much still the desert. I was able to spend a weekend in the desert in a tent. I didn't go on one of these camels. I didn't feel the need to experience that. But we do experience a lot of things in the country, and we try and get to know the country and learn about it. Now compare Senegal to Cameroon, which has 6 months of rain every year. Consequently, the trees grow beautifully, the fruit grow beautifully. There's a lot of harvesting of the wood, and obviously that has some ethical problems with taking too much of the wood out of the Congo Basin. But here we've got a cocoa plantation, and you can see it's really lush. And that is so different to Senegal. So we try and find out while we're there as much as we can about the country, because this helps us to treat the patients with an understanding. Now, I've put these pictures up, which is an area in Benin called Ouida. Now, they collected 14 million people up from Africa to get them on the slave trade ships. And they all came to Ouida. Only 11 million went from Ouida. And this is what was called the gate of no return, i.e. the people were walked through that area and they did never return. Now, the significance of going from Benin is that it's the main country which has voodoo, and I will talk a bit about that later. But knowing what happens in that country helps you to understand what's going on with the patients. So also, this was on a small safari I went to, but they have a lot of traditions. And in this area, they had some skulls in the bottom of a baobab tree. And these are storytellers, and they don't have written language, or they didn't have written language. So the history of the country was passed down by storytellers, and they were held in great esteem, and the skulls are still visible in this tree. I think they were about 400 years old. It's a very vibrant country, and you can see really colourful. fairly motorbikes in Benin and Cameroon were very colourful and looked to me to be quite dangerous. But you can see there the roads not bad in the cities and the towns, but actually go into the rural areas, and you can see why we need the all-terrain vehicles for getting the training and the clinicians out to hospitals in those areas. Very resourceful population, where the builders have to be able to make their own bricks first before they can do it. Their skills in carving and basket weaving is phenomenal. So the Mercy Ships has a 5-year engagement plan. And the first year, we don't just go in and say, this is what we're going to do. They invite us. And so that first year, it's signing off on protocol and planning what they're going to do. So they have to agree to give us port space and a certain services. The phase 2, or the second year, we advertise within the country. They go to clinics, radio stations, and say that we are coming. And the country will know at this stage what we can do to help them. The phase 3 is when we are actually in the country. So all the work that has been done in the previous year culminates in us getting the right patients in at the right time for the right doctors to treat them. A lot of training is done during that time with the local clinicians. And phase 4 is that we carry on with that training and support, and people will go out to clinics to check that things that have been put into that area are still being used correctly and they've got the support they need. And then the last year, it's a report to the World Health Organization and the Lancet, so that what we've actually achieved for that country is published. We partner with the nations. We want to transform the lives of the individuals, but really importantly, we want to leave a legacy of improved healthcare. On the ship, we have visitors coming from the Parliament. We have the President comes, usually the Minister of Health. Everything stops, and we all hide because it's only people in really posh uniforms, and we just get on with our work. But it's fun to see them arriving in their state cars. But these people, they don't pay anything. Everything for these people is free. And I will show a 2-minute video at the end, and you can see queues of people waiting to be seen. And in Guinea, we had 6,000 people all turn up on one day to be seen, to see whether we could actually help them. So during that time, we had the teams of people go out and actually look at patients and work out which ones we can actually help. It's really quite a tight criteria. And out of those 6,000, we had quite a lot that were not going to need any care from us. But a lot of them were. And for something like this child with bow legs, definitely a case that we could deal with. So I work as a plaster technician and a nurse. So I'm split between the physiotherapy department and the operating room. Now here you can see this is our huge team of physiotherapists, occupational therapists, all specialised in most of these were orthopedic, but some of them were on plastic, so they were hand physios as well. And we have day crew that work with us. So we can actually give them employment. We pay just above the basic rate, but they learn, and they are very important for us because they learn, they teach us how to care for their people. They learn skills and they translate for us. And although a lot of these countries are French speakers, in the case of Senegal, it was Wolof, and although we have a go at learning that, it's really good to have Senegalese people actually talking to their own people, and they get a skill from that as well. And this is the operating room team, and I put this one up because actually we are all from different countries all over the world, with the tall chap in the middle who is from Senegal, and he worked with us for 8 weeks learning the skills of doing surgery on the children, and it was a German doctor who was teaching him on this day. So in Senegal, this is the ship. It was very dusty. Obviously, we had the dust coming in from the Sahara, but also we always seem to be moored fairly near a cement works as well. So it did get a bit dusty. If you are able to see at the bow end of the ship, there is a container ship, and I will show you a close-up picture of that. In the inside of our ship, we have 5 operating theatres. One of them is eyes, one is, when I'm there, it's orthopedics. It switches between orthopedics and plastics. One is general surgery, and the others are maxillary facial, which is what our ship is renowned for. Total of 82 ward beds. Now, if you're building a new hospital in the UK, recommended 11 foot between the beds. Obviously, we can't do that. And the beds are really close together. And for me, plastering these children or doing anything with their plasters between the beds is quite difficult. But not only are they in the beds, their carer is under the bed or sleeping on a mattress. So the wards get very hot and very chaotic, very untidy, but great fun. We have a radiology department with a CT scanner, obviously not an MRI because that's we're on a metal ship, so that wouldn't work. We have a laboratory, and Darlene here is from the States, and she's been running it, and her specialty is doing the blood transfusion, because a lot of these patients come in and they need blood at the time or subsequently, and where are you going to get blood from in Africa? Well, it's the first thing we do when we get to the ship is actually agree that they can take our blood. So it's a real honor to give blood and actually then see the patient that has received it. So a little bit of me is still in Senegal. But they do all the other things that are normally happen in a hospital, which is blood tests, swabs, specimens, or lots of complicated stuff. Pharmacy, brilliant. They seem to have the right drugs for the whole time that we're in the country. Obviously, we know a good idea of what we're going to use, but they are superb at providing us with the right drugs. So these are the things that we will do on the ship: maxillary facial, plastic surgery, orthopedics, yeah, that's mine, obstetric fistula, so women who have given birth to a baby who has been stuck for some time, results in having a hole develop between the vagina, uterus, rectum. And some of these have had incontinence, total incontinence, for up to 20 years. So to be able to treat them is an absolute honor. And I was able to discharge very many of them when I was working as a nurse. And that was absolutely wonderful. A bit of general surgery, depending on what the country wants, eyes, dental, and palliative care. We don't do any surgery on known cancers. It is on, if we find somebody who has got an inoperable tumor or something, and they are nearing the end, some people will go out and give them the drugs that they need. I'm going to put up a few graphic images of some of the patients. So I told you about Guinea when 6,000 people all turned up. We were expecting about 200 of those to be cleft lip and palate children, babies' children, but there were only 6. And the reason was the previous time that the ship had been in Guinea, they had taught some local doctors how to do the surgery. These doctors had gone on to open a clinic and were then able to do the children as and when they needed it. In Guinea, we saw some that came from a long distance away, but we didn't see the amount that we would normally see. Unfortunately, this little boy turned up in Cameroon The ship arrived and the mother brought this child, and you can see he's 3 months old. He weighed less than he did at birth, and he was not surviving. He had his mother was only able to give him some rusk in some water. Not fit for surgery because he was very, very poor state. So the infant feeding team got to work on him and made him put on large quantities of weight. So after 3 months, this is what he looked like, and he was fit enough then to have surgery. We developed a relationship with the mother, and she was so delighted with her baby. She was able to take him back to her village and present him as, look at my beautiful boy. We do see a lot of burns, and people in Africa don't know how to treat burns. In a child who falls into a fire or gets severely burnt, they would just wrap them up in a blanket. Consequently, the skin will contract. So this little girl got burnt at a year, and she had no movement in her elbows, her wrists, or her fingers. A lot of these patients will hide. They can't go to school. They are laughed at. But she had surgery. Now, we can't get rid of scars, but we can release the tendons and the ligaments and put skin grafts on to give them movement. And this then means that they are able to go to school and be able to have employment and get married, which the schooling for them is really important. She was delighted. Now, orthopedics. This is the sort of operations that we do. You can see on the left that the bones look particularly bent. We only have one opportunity to go in and break one bone and plaster it. And then we leave it up to the body to straighten up the other bits. So we have a little child here called Djimbi, who had come just over 100 miles with her grandmother to the ship. She was in constant pain, had cried a lot because she was unable to walk or walk particularly well. She came with such great expectations, and this is me. This is the only one you've got of me. Oh no, I think there's another one, but ready to take her plasters off. And she was a lovely little girl. And for the time that she was with us, she was an absolute delight. You can see there her grandmother looking on and so happy to be able to go home walking with straight legs and not in any pain. We do an awful lot of eyes, and it's usually, mostly it's cataracts. And for this girl, she became pregnant and she lost her sight. And she thought that when she had her baby, that she would be able to see again. But she had twins and she certainly wasn't able to see again. But the ship came to the country soon after she had the children, and she had surgery and she was able to see her children for the first time. So not only did this give her life, it gave life to her children, who would not be burdened with actually taking her around and looking after her. We do also do the children as well, cataracts, and these three children, actually their mother had surgery when the ship was in Madagascar for the same condition. She then went on to have these three children who all developed or had pediatric cataracts, and they had surgery and were able to then be able to see and delight in being able to see and go to school as well. Now, this little child was in Benin, and you can imagine if you have a child that looks like this in a country where voodoo is the religion, you can imagine what they think about this lump on his head. This child was shunned. You can see the fear and horror in his eyes. You can see that his mother didn't really want anything to do with him. And of course, the parents and the family were ostracized within their village. All he had was, when you start as a tiny 2-3 week old fetus, you sort of start flat and then you develop into a round, and that's where the problem comes with cleft lip and palate. And for this is an encephalocele. The bones just don't meet up in the middle. He had surgery, and you can see there that the delight in his mother's face as he is restored to a normal looking child who was then going to be accepted into the village. Give a man a fish and he'll eat for a day, and teach him to fish and he'll eat for a lifetime. Very much our thinking. Outside the orthopedic ward, I saw the day crew, and they were giving the children breakfast, and we give them, the orthopedic children, we feed them up really well because it is basically very poor nutrition that has developed these conditions. And they were drinking black coffee because that is what they were weaned on. So as soon as they came off the breast as babies, they would have black coffee. I said to a mother one day, what do you give your child for breakfast? Oh, they had rice. And for lunch, yes, rice. And in the evening, oh, they'd have rice again. So these children were not hungry, but they were so malnourished. Now, that's the ship that was moored very close to us. And every 14 days, we got another one in. And this ship unloaded 32,000 tons of rice to Senegal. Every 14 days, a new one would come. I was able to go on the ship. Not that you would see it on TripAdvisor, but really interesting to be able to go on a ship and see just how it worked and have some fun with each other. Now, diet and food is really important, but how do you get a country to improve the way they farm? And we have a lovely man called Eliphas, comes from Benin, and he started a agricultural program where he takes about 50 students for 32 weeks, teaches them how to farm. The middle one at the bottom is they built a hydroponics unit for growing tomatoes and also keeping fish, and consequently they were able to, this is just made up with things that they can get in their normal in the village. It's fairly simple to set up. Now these students then go on to teach others how, and other farmers, how to improve their things they grow, from the mushrooms to the cows. Sometimes they have rabbits, and you can see there at the top, that one is in Senegal. Trying to grow anything in Senegal was really difficult, and they did manage with companion planting. That was their first crop of pumpkin or some something that they grew. But that is really important if we can improve the vegetation. So along with that, and what we are known for, is the training and mentoring local professionals and providing medical tools and resources and building better medical facilities. And you can see there, this is an area that we need somewhere for the people to come to the ship, for them to stay. And we will convert a building and houses about 200 people, and then it is given back to the country afterwards, where they will use it as an A&E department or maternity or something on the health side. We want to make things better for them. I did go to a local hospital after a lot of work. This is a couple of plaster technicians, and I said I would go and help them and do a day's training. That was the equipment that they had on the left, which actually was the only equipment for the A&E department, the outpatients, and theatre. And they did have an electric saw, but just one hand saw. And I planned to do a day's training for these two, plus I had a translator with me. And I ended up with 12 people, which was really good. In Madagascar, to have a surgery or theatre like this, 50% chance of dying. So they renovated 5 to look like that, putting in the equipment and the training for those, the equipment. In Guinea, we discovered that the local dentists were coming out of their training university without having any practical skills. So one of the floors was taken over by mercy ships, and the clinics, rather than being in the villages and the city, we had it at the university, and the patients were seen there, and students and the professors and the teachers were taught how to do things. And this equipment on the right is an X-ray machine that picks up problems in the mouth before it becomes acute. And the things that they're looking for that causes most of the problems is a tumor that starts from the tooth enamel, they think, called ameloblastoma. So these are two photos off the internet, or two X-rays, and you can see there's a gap in the person's jaw at the top. And what we do is we will take that out, put in a metal plate, and then 3 months later go back in and put a bone graft. Consequently, this is the sort of thing that is very common on the ship. And this girl was operated on, and she went on to become a nurse in the Republic of Congo. So she had a life. And you can see that the tumor, it's sticking out a long way, but also it goes in. So they're not cancerous, but they will kill because you are neither able to breathe or to eat. So to have a face which doesn't make you turn and look and be stared at gives her hope and just a life. You can see there we have volunteers from all over the world. We do have quite a lot from the United States, I must say. It is our biggest source of volunteers. And we have a lot of volunteers annually, and from 40 different countries. We pay our own crew fees and we pay our travel, but only half of them are medical. So we are a team. There are so many people that we need on the ship. We couldn't do it without the housekeepers or the dining room staff or the caterers. It is so important. And obviously being on a ship, we have the maritime as well. So you can see there a lot of things that go on the ship, from the maintenance of the Land Rovers to scuba diving to change the filters under the ship, and teaching as well. Our Gurkhas are our security, and they are lovely. In Senegal, we did have an impact. Unfortunately, we had to pull out early due to COVID. And unfortunately, we've not been able to go back, and we are waiting to go back to Senegal to finish the work that was started. But we have a new ship called the Global Mercy. It's bigger, it's better, it's got a lot more teaching and conference space. These are the sort of tumours we see. We can't change the whole world, but we can change the whole world for the individuals, one life at a time. You can go onto the Mercy Ships website. You can look on Vimeo Mercy Ships. You can see a lot of videos all about the patients that we see. And it is amazing to actually follow a patient through and to be able to see the hope and the joy in their eyes as they actually are restored to full health. So together we work for these people in Africa that don't have anything. We need volunteers. We've now got 2 ships. Could you do it after you've been trained? Do you know somebody who can? Can you get involved? I'm going to now share let's stop share for a minute. I'm going to now put a video on, and which is only 2 minutes, which I think you'll find interesting. Sorry. Bother. I forgot to screen share. And now I have come out of there. I'm sorry. I've just closed it down. How awkward. That's it. Open. I want to screen share. Screen share. Right, let's minimize that. I don't know now whether I'm on screen share. Oh gosh, I'm sorry.
Hi, Ruth. It's okay. Are you able to click that button at the bottom that
Yeah,
says share screen?
I'm just gonna put that on full. I've now lost me.
If you run into
Hang on, I should no, because I've lost myself. Oh, have I come out of Zoom?
we can see you.
But you can't see the video, can you?
No, but it's okay. Would you like to email me the video and I can share it from my end?
But I've only got you tiny. All I've got is your pre-health care one now. How do I get back out of that? I've sort of lost Zoom. Have I lost Zoom?
If you'd like to, well, we
Yeah.
can see you. So as long as you can hear us, we can still do the Q&A.
Yeah, okay, let's do the Q&A.
Okay, perfect. And if after this session today, feel free to send us your video. We would be happy to email it to all of our attendees and include it on our website as well.
Okay.
Okay, Angela, or Jacinta, sorry. Go ahead.
Thank you so much for that presentation. I'm sure I really enjoyed that presentation and many of our audience members have as well. One question we have is, would you be able to volunteer for a short period of time, for example, as a college student during the summer?
Yes, now the Africa Mercy tends to break during the summer. The Global Mercy will be on, which is the new one, which will be on a different time schedule. They like loads of people to volunteer. You can volunteer from 2 weeks up to 3 months or full time. It does cost quite a bit the first time you go. For me, it became fairly addictive. Once you've been once, you can't, it's very much then you want to go back. You see such a change in people. It's a real delight to see countries that you wouldn't see normally. And it's just so delightful to be able to treat these patients, play with them, get to know them, and also the day crew that you work with. So yes, you know, we need people like housekeeping. They don't take any trainees actually. If you're physio or occupational therapy or a doctor, you need to actually be qualified. But there are so many jobs on the ship. But certainly when people are qualified, yes, anything from 2 weeks up to 5 years or 10 years, whatever. Somebody's been on there 20 years. So, you know, it is addictive.
Great, thank you. Someone else was wondering, how do you sign up to volunteer and whether you take lab professionals?
If you go onto the Mercy Ships website, all the jobs are there, whether you want to be the captain, first officer, electrician, right down to a nurse. All the jobs are there and when the vacancies are. Now, obviously with COVID, we don't know quite what is happening with the ships. Hopefully the African Mercy will go back to Senegal and the Global Mercy will join the African Mercy there because they need to move quite a lot of stuff across. Then the African Mercy will go down to South Africa for some refitting. And once that is done, then we will have the 2 ships in service. But COVID at the moment, I'm afraid Africa are not getting vaccines in, and so many people they don't know the statistics, but I think only 5% of the population in West Africa has been vaccinated.
Well, thank you for that answer. Someone else was wondering, what are the costs of volunteering?
If you're coming from somewhere like the UK or France, Germany, the States, the first time you go, it does work out probably I can't compute it into dollars, but for me, I suppose it was about 500, maybe. I think it was something like £800 for my 6 weeks that I was there. That is your crew fees. Then, of course, you've got your flight out there. You need all your vaccinations from the yellow fever and all the ones that they require. So it is the first time you go, it is quite expensive, but each time you go, the crew fees go down. So I have been out for 6 weeks as a nurse, 8 weeks as a nurse, 3 months as a nurse and plaster technician, and as another 3 months as a nurse and plaster technician in Senegal. So it gets cheaper each time. And you'll find that people actually want to help with the crew fees. And they will donate to you or do crowdfunding, or people want to support the work, but if they have a personal attachment to you, you'll find that people will help towards the crew fees.
That's amazing. Thank you. Yes, someone in the chat mentioned that their cousin worked on the ship for a year and it was the best experience of her life there, working there.
Yeah, it's a fantastic experience. It's lovely to see the country. It's lovely. I've been and seen places that I never even dreamt that I would see. To go on a cocoa plantation and actually break the cocoa pods open, and actually brought some home and fermented my own cocoa beans. But to go on a ship, in the port, to go and see waterfalls that have and places that in history you've only ever read about, and the UNESCO sites as well. I haven't seen any elephants. I've seen giraffes and zebras and a few other things, and I've eaten rotting pine caterpillars. Yeah, it's great. It really is lovely, and for me, it did become addictive, and I can't wait to go back out. We'll have to just see.
I can see why. That sounds amazing. What do you think is your favorite experience working on the African Mercy?
Well, the first time I went, I worked a whole shift, a whole day, and if actually they work you quite hard. And then I had to file some patients' notes at the end, and I think I was still doing it at 11 o'clock at night. And because I'd broken, there was something I had to do in the middle of the evening. And then I went back and somebody said, "Are you all right?" And I said, "I don't think I ever want to set foot on this ship again." For me, I think the experience of discharging ladies who had been incontinent for years and years, and being able to discharge them as people who could not dribble urine for whole, wherever they go, they have become social outcasts, and to be able to explain to them why it happened, and see them go with this huge smile on their face, that is an absolute delight. And it is wonderful to see children walking with straight legs, to see their faces change from absolute horror to realizing that they can run, they can play football, they're not going to be looked at. They've got a place in society. Sitting at a table, they can eat with other people and not go around with cloths over their faces, fearing that they're going to die, which is what would happen. And of course, with no health care and no social services, with no chance of employment, they were deemed to be unemployable and would spend their time begging. And that's sad when you see conditions of people on the streets. You see them with legs that are bowed or bent the wrong way or knock-kneed, and they can't walk, and they're just sat on the side just waiting for somebody to give them some food or money or something, because they have nothing. So yeah, I mean, every country has been totally different, and I have thoroughly enjoyed my time on the ship. Yes, it's got its stresses. We all work in different ways, and working with Americans and Dutch and Swiss and French. English, thankfully, is the language spoken, and we all have different ways of doing things, and it's actually being a team together to get the patient healed.
Thank you. That was an amazing answer. We actually have a question about teamwork. How would you consider the environment of teamwork on the ship? Do you think anyone from any background can assimilate and feel supported?
Yes. Some countries work better with each other than others, but it's really important that you see that everybody has something to offer. It's very easy to think that the housekeeper who's sweeping those stairs, and I can tell you there's an awful lot of stairs, and the swimming pool on the top deck on the Africa Mercy, from the cabin that I had the first year was down on deck 2, which is way below the waterline. It was 100 steps from my cabin up to the swimming pool. And if you forget your goggles, you're never going to go back down to get them. And but people are cleaning the stairs, cleaning the corridors, and it's very easy to walk past them and just think, oh, they're just a cleaner. But without that cleanliness on the ship, we're going to get infections. And actually, if you talk to these people, we had one lovely lady, and she was a barrister in the States, and she would come and clean the corridors because that's what she felt was something that she could do. We had lots of people. Everybody has something to offer and to give, and we couldn't do what we do without everybody working together. Yes, we have chaplains that support us and talk to the patients, and it's good time. Obviously, you don't get on with everybody, and you are sharing a cabin, so the chances of being in a cabin with somebody you don't get on with does happen occasionally, but you can move. It's most times it's really, really good. But we're all stressed, we all work hard, and we all have fun together. And we all go out for meals together and just enjoy each other's company and working together. The X-ray people, the physios, the OTs, the day crew. It's wonderful.
Great, thank you. It's wonderful to see everyone come together to do some meaningful work.
Yeah.
Another question that we have is, did you have to sacrifice anything to be able to do the work you do on the Africa Mercy?
The time I found more difficult was the first time I went to Guinea, and I was there for 3 months, and it was over Christmas. So I am married, I have a husband, I have to leave him at home, and I have children and I have grandchildren, and to go away for 3 months over Christmas and leave the family, that's hard. It's hard for my husband, and it was hard for the children as well. In Senegal, we did break over the week of Christmas, and actually somebody paid for my flight home, and I came home for the Christmas for 10 days. I actually wasn't very well, but that's different. I picked up some bug while I was out there. Yeah, it is, and it's tiring, and I come back and I'm absolutely exhausted. And you realize that you've lived in a cabin, you've had very little clothes to wear, and you realize you don't need all the clutter that you have at home. And you can see the back of my study, and I won't turn the screen around because it is all clutter. And I just, every time I come back, I think, no, I don't need that. I don't need that, and I try and slim it all down, but it all builds up again. So do I miss something? Yes, the family, obviously. But with Zoom and the first time I went, my 3-year-old granddaughter, now children are very used to Zooms and FaceTime. But my daughter showed her, and I WhatsApped her, and I went, "Hello, Zoe." And there was this look of horror. How did grandma get in there? She'd only seen me a few days earlier, and there I was in the phone. She was horrified, but technology moves on, doesn't it? And she's quite used to it now.
Well, thank you for making all the sacrifices that you do. We have a question about some of the cataract cases that you mentioned. This is what they asked. They said they were curious about the cataract cases that you shared, especially because they were such young patients. Are they sporadic cases, or are cataracts really prevalent in the area that you served? What was the cause for the cataracts on those children?
Some of them are congenital, which you get in you'd get them in the States and in this country as well. And some is just I think it's the sun that probably causes it. But you get older and people have cataracts. And I'm sure in the States they get operated on fairly quickly. When it first starts to become, your vision becomes a bit blurred. Whereas there, the vision becomes blurred and you become blind. With a child, they will operate on both eyes. With an adult, they will only do one eye, because you can get more people through by doing one eye, and most people can manage on just one eye. But for them to take the patches off at 2 days, and for them to be able to see for the first time is truly amazing and joyful for them. Yeah. But ophthalmics is not my field. I can talk at length about orthopedics. Eyes, a little bit. I've watched a cataract operation and amazed at the instruments that they use, which are so tiny compared to the orthopedic ones, which are huge. Yeah.
Amazing, thank you. Someone was wondering, does anyone decide to work on the ship full time, and are there any paid positions?
The only paid positions are the Gurkhas, because they are our security, and they do 3 months on and 3 months off, and are paid for doing that. And there's 8 of them. Unfortunately, one went back to Nepal, and as you know, COVID swept through Nepal, and he has not survived. He went back because his family were ill, and unfortunately he's died. Those are the only paid people. We don't get off the ship or onto the ship without swiping a card. At all times, we need to know exactly who is on the ship in the event of fire safety. So every 2 weeks we have a fire drill, and we all have to go out onto the dock and be counted up. The people in theatre, also the OR, or on the wards stay, but they're counted. In the event of an actual fire, there are ways of getting them out, but we don't do that in a general fire drill. And in the when the ship is under sail, some countries, there's a lot of problems with pirates, and sometimes the Navy will escort the ship past, so Nigeria, for example. But the Gurkhas are very very concerned with safety and pirates when the ship is underway. So they're the security there. They did have a stowaway from one country. Two chaps got on and actually hid in the lifeboat. But of course, that was a real problem because the ship then had to turn round, have to go back to, I think they were 2 days out of the country, and I can't remember where it was, but they had to turn round. I think they were fined because you can't have stowaways, so they had to return to the country, and you can imagine the amount of fuel it took for 4 or 5 days extra sailing. But these stowaways were the best fed stowaways probably in history and looked after once they found them.
Great, thank you for that response. Unfortunately, that's all the time we have today for this session, but thank you so much for that presentation. It was amazing to hear about your experiences and the different cases and the people you treated. So thank you so much for speaking at this conference.
Okay, well, I will send you the WeTransfer email that I got, which you should be able to send out as well, and people can download. And I'm sorry, and I've lost the screen.
No worries at all. Thank you so much. And thank you everyone for attending the session and attending the conference. Please stay tuned for the closing statement from our co-founders in a few minutes.
Thank you.